Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on this Health Suppliers segment. Our guest in studio has developed a very effective way of dealing with scar tissue. Our guest today is Marjorie Brook. She's an internationally known body worker, and she's here today to talk with us about her method of dealing with scar tissue known as the STRAIT method. Welcome to Health Professional Radio, Marjorie.
Oh, thank you very much, Neal. It's a pleasure to be here.
You know, I have had surgery myself, an appendectomy. I've got a scar. There's some sports injuries that have left a couple of scars or two that have never gone away. I never paid any attention to them, but you're passionate about scar tissue and the effects that it has on the body overall. How did scar tissue become a passion of yours?
Actually started with my very first client in student clinic when I was in school. Mm-hmm. He had been coming to the clinic for over 10 years for discounted student massage, and I was reading his back history of his medical notes, and every single one had the same complaint: lower back pain, lower back pain, lower back pain. And I said, well, that's odd. He's been coming for so long and no one's helped him. And then when I went into the room to start the session, his entire stomach was covered with scars. One that actually occurred when he was 18 days old. From a surgery, appendectomy when he was 13, and then when he was 44, a huge scar up the center of his abdomen because he had small intestine blockage, which actually was caused by the scar tissue, which spread from the other two surgeries and blocked up his intestines. Now, they didn't think anybody to ever remove the scar tissue. They just went in and removed a whole bunch of his intestines and gave him another huge scar. And it was all of those scars that were pulling together from the front that was causing the lower back pain.
Wow.
It's like a huge culprit. Like you'll see that with your women with C-sections as well. A lot of their lower back pain has to do with the C-section scar.
You know, I never thought of a scar being anything more than just the body healing itself. And I always thought scarring was natural and beneficial. What exactly is scar tissue?
Well, scar tissue is part of the natural healing process, and it is necessary because it replaces, if you're talking from surgery, it's replacing normal tissue that's been damaged. Or if you're talking from an accident, say all the kids doing the extreme sports and they get the road rash because they fell and scraped and did all the abrasions. Mm-hmm. Scar tissue does, in fact, replace normal tissue, but it doesn't kind of end there. Not every scar is an issue, but the majority of them have a problem because scar tissue is actually only 70% as functional as normal tissue to start with. And the restrictions and the pulls that it causes on the rest of your body, your connective tissue, actually can lead later to different issues. In fact, most of my clients and adults, 60% of them, you could probably trace back their issues to a fall or an accident or something that happened when they were younger.
You said that some scars do certain things while others affect the body in different ways. I know that the appearance of scars differ, but are there different types of scars that differ other than just appearance?
Oh, yes. Well, in appearance right away, every scar is different. You can have a hypertrophic, a keloid scar. You can have an atrophic, which is a depressed scar. Hypertrophic is raised. Keloids, as most people know, they are actually the misnomers people don't understand about keloids. They think they're scars. There's scar tissue around them, but keloids are actually non-malignant tumors that continue to grow. But what it is when you think about scars, what you really have to think about for the majority of them is that big famous picture of an iceberg where you see the tip of the iceberg at the top, but then when you look below which looks enormous, but then when you look at below the waterline, how huge the iceberg really is and how it's spread out. That's a very good analogy for scar tissue. And like I said, it does affect. I mean, something as simple as tattooing. The people who get the full body art, like the full sleeves and the full legs and all of that. That's tattooing. As much as I'm not against tattooing, I'm all for it, but only as informed, because tattooing is actually scarring your body. And it causes the tissue to restrict. And the thing is, the reason you don't realize a lot of your scars are bothering you, Neal, is that it's your norm now. You've grown with them. You've gotten used to them. So you actually don't really realize how it's affecting you because it's become your norm. And you don't know whether or not you're actually compensating because of the altered tension and the pull from the scar tissue, and the fact that it's interfering with your circulation and of all types, from lymphatic to the arterial and the vascular. It's basically, there's all different kinds of ways that the scar tissue can affect you. I could talk for hours, obviously, but we won't be doing that today. It's just the big goal for me is just to get people to start looking and paying attention, because a lot of the issues that scarred people have, they don't even realize are at the root is their scars. And on top of that, a lot of it is preventable.
Well, let's discuss, say, a deep puncture wound. The tissue's damaged to a certain degree on all the way down, say, to the bone or whatever, or past. And then you've got, say, a burn. Mm-hmm. Why is it, do you think, that with such an invasive scar, that we're not told that, well, when your leg begins to heal after this surgery, if surgery is necessary, that there's going to be all this pulling going on? It seems that we're just left to experience that and wonder what's going on until someone such as yourself, gives us some understanding. You're the first person that I've ever spoken with whose knowledge and interest in scar tissue goes even a fraction as deep as it does.
Well, the reason is, in all honesty, is that because basically the medical profession doesn't really pay attention to scars. It's different with burns. They do pay attention with burns. But with something like a puncture wound or a surgery scar, once you've healed and you don't show a sign of infection and they didn't leave anything inside of you, then they're like, they did their job, go ahead. In fact, a lot of people, they'll have symptoms and problems, and they'll be going to the doctors for years trying to figure out what's wrong with them. Why, is my shoulder bothering me? Why do I have problems, with digestion? All of these different things. And the doctors treat them like they're crazy. And after a while, their family members and their friends stop complaining. You're crazy. There's nothing wrong with you. They can't find anything. And the root of the problem is the scar tissue. And so the reason that it's being more aware today, I've been working with scar tissue my whole career. I'm a therapist for 20 years. But the reason it's getting more acknowledgement now is because people are now paying attention to connective tissue and to fascia. It's it's one of the big buzzwords now, fascia, fascia, fascia. And because of that, more research is being done. And because people are now aware of how important our connective tissue is, scars are now starting, literally, no puns intended, rising to the surface of people's awareness.
Now, you've developed a very effective way of dealing with scar tissue. As you mentioned, your first patient that kind of the light went on about scar tissue therapy. Talk about this new method that you've developed called the STRAIT method.
Well, the STRAIT method stands for Scar Tissue Release and Integrative Therapies. Oh, okay. Over the years, I've combined all my knowledge with bodywork and body mechanics, and dealing with sensory integration and emotions, the body-mind connection. And I've just come together with a whole bunch of different modalities. For the physical, we have hands-on, and we have a hands-on technique that I put together combined with other modalities such as cupping and therapeutic stretching and strengthening. Because one of the big things about scar tissue is that once you've released it or made a difference, you can't just say, okay, I've released your scars, go on your merry way. Mm-hmm. You've altered the body, the way the body functions, because you've released a lot of the tension under which the body works. So then you have to go through the rehab of basically resetting the body to function the way it was designed, not the way it's compensated over 5, 10, 15, 20 years. And we've had massive results from the beginning. And the other big side of the STRAIT method is also dealing with the emotional effects of scarring, because scars are very much related to PTSD and basically all the emotions wrapped around the event, not just the actual occurrence of the event, but things that were going on around the event that caused the scarring is pretty much can be triggered, the memories and the emotions, by pressure or pulling on the scar tissue, or simply by seeing the scar can do that.
You mentioned that scar tissue is only 70% as functional as its surrounding tissue. Mm-hmm. Once you've employed your STRAIT method, is there any additional degree of functionality in the scar tissue? Is that affected as well?
Well, the functionality, as far as it being more like normal tissue, in that aspect, no. But what it does do is release all of the stuck adhered tissue. It improves and increases circulation, both for the blood and for the lymphatics. It increases range of motion and relieves all of the tension, so the body's homeostasis can go back to normal. The key about the scar is that scar tissue acts like a dam, and it blocks the normal functionings of the body. Once we open it up and get the adhered part of it gone, then the body can start to reset itself and function much more normally, and pulls and pains from other areas or within that area. We have things where, like after a C-section, very often women will find from the C-section scar down that they're numb or hypersensitive. A lot of people with other scars, they're hypersensitive to the scar tissue conducts pain 1,000 times more efficiently. And they'll be hypersensitive to the touch, like they can't wear their clothes correctly, or if somebody leans against a scar, it freaks them out. And we can reduce and get rid of all of that. We can get rid of the numbness and bring the tissue back to feeling like live, normal tissue again. So there's a lot of functioning that is restored to the body, not necessarily, so I don't sound like I'm making something up. Scar tissue will always be 70% less functional than normal tissue, but everything else that it blocks and bothers and offsets, we can correct.
Okay, so say you've had your surgery, your injury's been repaired, and I guess a normal period of time goes by where you're experiencing some pain due to healing. When would you say is it time to stand up and take notice because something is happening that you don't, it shouldn't be hurting like this long after the scar tissue has developed? In your experience, when should someone start to take notice and seek some therapy from you?
Well, before me, before anything, before the surgery, therapy starts. In other words, before anybody has any type of surgery, if at all possible, they should have at least 2 lymphatic massages within 48 to 72 hours before the surgery to clear out and bolster their immune system. Immediately out of surgery, and for the first 3 months, which is the healing area, a time period of the first phase, the immature phase of the healing of the wound, you want to get lymphatic massage, very light myofascial massage. You can come to me for very light therapeutic range of motion stretching to reestablish the body, to keep it from setting into compensation. Then after 3 months, if there's still pulls and pain and things aren't right, anytime after 3 months up to 80 years and then some, you can come to a STRAIT method practitioner and get work done.
Okay. Now, you're also a conductor of seminars. Where can our listeners go and get more information about your seminars and about the STRAIT method that you've developed to deal with scar tissue?
Well, they can visit my website, which is very easy. It's Marjorie Brook seminars.com. So it's only one of me, B-R-O-K. There's no extra S in there. So it's marjoriebrookseminars.com, or they can look it up, Marjorie Brook or Brook Seminars on Facebook. I have a lot of stuff on there as well. And we can also give a call right here out to New York, 516-409-1240, and contact me. You can email me. I'm always around for consultations, or if people have a question to see if what they're experiencing is actually a problem.
Well, it's been a pleasure, Marjorie.
And it's for me too as well, Neal. Thank you.
Thank you. You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Marjorie Brook, internationally recognized bodyworker and pioneer in the field of scar tissue release. And she's developed the STRAIT method, scar tissue release and integrated therapies, which works with the body as opposed to against it when dealing with scar tissue. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download on SoundCloud.